Hi everyone and good morning. Today we're going to cover topic 13, the use and abuse of drugs. So for the first part of this topic, we're going to define drugs and drug abuse. Your first learning objective is 13A. Define a drug as any externally administered substance that modifies or affects chemical reactions in the body. So your step to success for this part is to just state the definition of drugs using the key words. So what are drugs? A drug is an externally administered substance which modifies or affects chemical reactions in the body. Externally administered means that you take it in from the outside, and it is a substance that can modify or change the chemical reactions or in a way affect the organs and how your organs work. So in the O-Level Section B mark scheme, you can get 1 mark for mentioning externally administered or taken, so here. Your second mark comes from saying that a drug is a chemical substance, so a substance or a chemical. And the third mark comes from saying that a drug modifies or affects or alters. And the fourth mark goes to saying that it alters the chemical reactions or metabolism in your body. Why aren't hormones drugs? Why isn't a hormone a drug? So if you recall the definition of a hormone, we say that hormone is a chemical substance which is made up of protein, and it is actually made in glands, and it is transported in the blood and delivered to target organs where it affects the target organ's activity, and then the hormone will then be destroyed in the liver, and that's how the effect will stop. So hormones itself, I know that was a very, very long definition, but in a way, hormones and drugs are pretty similar in a way that they change the chemical reactions in your body. However, hormones are chemicals that are actually manufactured within. So remember that drugs are externally administered. That means that you take it in from the outside. And hormones itself, you don't take it in, but it is made from your body, within your body. And is made within that living organism itself and has a specific effect on the organism's metabolism. The word metabolism here means the sum of all chemical reactions in your body, and that includes anabolic reactions. And anabolic reactions are basically reactions that build up a substance or a molecule from smaller molecules. So for example, insulin is a hormone. And what insulin does is that it will encourage the uptake of glucose into the liver or the muscle cells. And when the muscles and liver take in more glucose, what they do is that they want to store the glucose, and they convert that glucose into a bigger molecule like glycogen. So that chemical reaction, converting glucose to glycogen for storage, is an example of anabolic reaction from small to big. Metabolism also includes catabolic reactions. And how I remember this is I think about a cat. Cats destroy things. So catabolic reactions are chemical reactions that break big molecules into smaller molecules. So a very good example is the chemical reaction digestion, which makes or breaks up a big insoluble molecule to become smaller and soluble molecule. Another catabolic reaction could also be respiration, where you have glucose, and this is where you release energy after you break down glucose. And it will actually become smaller molecules as well. It becomes carbon dioxide and water. So that is an example of catabolic reaction. So one of the parts we need to talk about is that drugs are beneficial for you, and they're not just bad. The term drug itself is referring to any type of chemical that you externally administer to help change the metabolism. And in other countries, we do call like shops like Guardian as like drug stores. It means that they sell all of these drugs, which means things, chemicals that you take in. So drugs are beneficial because they can give pain relief, and specific drugs examples are aspirin, paracetamol, and morphine. We have antibiotics. So this is your learning objective, to describe the medicinal use of antibiotics for treatment of bacterial infection. And to achieve this learning objective, all you have to do is to mention the name of the antibiotic and the type of bacterial infection that it treats. So another beneficial effect of a drug is to treat diseases. For example, syphilis is an STD, but we don't use the word STD anymore. We use the term STI for sexually transmitted infection. And syphilis causes sores in parts of the body. So an example is that syphilis can be treated by the antibiotics penicillin. So that's the name of the antibiotics. Another example of a beneficial effect of a drug is mood influencing. This means that you can treat patients with emotional disorders, for example, depression, using the drug. So this is an example of a brand called Zoloft, and I think it's called Sertraline or Cetracycline. I'm sorry, I'm not so sure. We'll need to look it up on the internet. Okay, although drugs can be good for you and has beneficial effects, so there are the 3 beneficial effects that we mentioned. The first one was pain relief, for example, paracetamol, and the second one was treatment of diseases, for example, antibiotics would treat syphilis. Penicillin is the antibiotic that treats syphilis, and the third one was treating mood disorders, for example, depression, using antidepressants. However, drugs can also bring detrimental effects on person if drugs are abused. So if a drug is taken simply for enjoyment or used as a recreational drug, this means that is the term drug abuse. It's being abused, and it is used often in high dosage. This can lead to addiction, and this part here, the addiction, is the one that can cause a lot of problems. So examples of drugs that can lead to addiction and that are commonly abused is heroin, alcohol, and nicotine. So let's talk about the effects of heroin first. This is your learning objective. Describe the effects of the abuse of heroin, a powerful depressant, problems of addiction, severe withdrawal symptoms, and associated problems such as crime and infection, for example, AIDS. So the step to success is to state the effects of heroin and the problems associated with heroin addiction. Heroin is a depressant. Depressant drugs means that they affect the central nervous system, which means your brain and the spinal cord. It slows down the messages that are sent between the brain and the body. And heroin itself is a very powerful depressant. And this is how it looks like. Commonly in movies, we usually see heroin as a white powder. However, mostly heroin is commonly taken in and administered through syringes. So what they do is they use a needle and a syringe and they inject it into their vein. And this liquid right here is how heroin looks like when it becomes a liquid. Depressants can affect the concentration and coordination, and this is what happens to if somebody takes heroin in low doses. It removes the feeling of anxiety, making the person feel more relaxed, feeling extreme well-being. Well-being means that they feel good. In high doses, it can cause drowsiness, vomiting, and unconsciousness, and even death. Heroin itself is a drug to which the body shows tolerance. What tolerance to drugs means is that the body requires increased doses in order to get the same effect of that drug. And if somebody doesn't take in that drug and is dependent on it and becomes addicted to it, they can actually have these withdrawal symptoms, develop withdrawal symptoms if they don't take it anymore. Once a drug user ends up in a state of dependence on the drug, if they are unable to obtain further supply, they will develop these withdrawal symptoms, which include diarrhea, vomiting, muscular pain, shaking, and hallucination. Some problems that can arise from heroin addiction also include crime, contracting hepatitis, and contracting AIDS. The reason for why people can lead to crime is because addiction can lead to the user into a life of crime in order to obtain money and or regular supplies of the drug. Heroin is a drug normally taken by injection into a vein, so if several addicts use the same unsterilized needles, there is a high risk of contracting bloodborne diseases like hepatitis and AIDS. Hepatitis and AIDS are both caused by viruses. Hepatitis is a virus that damages the liver, and AIDS is caused by HIV virus. Okay, now let's move on to talking about alcohol. So your next learning objective is to describe the effects of excessive consumption of alcohol, which include reduced self-control, depressant, effect on the reaction times, damage to liver, and social implications. So the step to success is to state the effect of alcohol and state the problems of alcohol addiction. Again, alcohol is a depressant, and a depressant is a drug that can affect the central nervous system, slowing down the messages between the brain and the body. It is widely available in other countries than Brunei, by the way, and is widely used in other countries. It is a depressant, and this is how it looks like. There are many types of brands of different types of alcohol as well. Effects of alcohol include, as a depressant, it creates a feeling of well-being. It slows down reaction time. That means increasing the risk of accidents. So what do we mean by slowing down reaction time? It means that the reaction time becomes longer. So the shorter reaction time, it means you are quick to react. But when reaction time is slowed down, that means that the reaction time is longer and you are slower to react to any stimulus. So this is an example of a video that was captured by a drunk driver. You can see that the person is very slow and ended up crashing into that car. Another effect of alcohol includes excessive quantities that can lead to loss of self-control, and excessive quantities also can cause liver damage, aka cirrhosis. And here is a picture of a liver that has been damaged already and is what we call cirrhosis. And you can see the bumps on that liver. It doesn't look healthy at all. During liver cirrhosis, the cells of the liver become very hard and some of them also die. And when your liver is damaged and doesn't work anymore, it can lead to death. Problems with alcohol addiction can include family issues due to lack of finance, because a person becomes very, very addicted to alcohol and has a lot of cravings and spend lots of money on alcohol. And another one is family can suffer from physical abuse from being an alcohol addict. This is the part where the effect of alcohol of losing self-control. Self-control really includes emotions, so the person can feel more angrier, can't control feeling sad and angry, and may abuse their family members. So that's all for today. Thank you so much for spending time with me, and I'll see you guys next time. Bye!